All right, thanks, Ron. We're here to talk today a little bit about all these new initiatives, and if you don't really have the infrastructure refreshed with both the network and security infrastructure, with the rate of change today, with users working from anywhere, applications being anywhere, the explosion of Internet of Things, you have a lot of challenges. So I want to outline some of the key things to consider to really put yourself in a position to deploy services that you can't anticipate immediately. Some of the examples we're talking about, not just the user experience of the healthcare professional, but also the patient experience, and the wireless monitors that might be in their home, could be in the hospital, could be anywhere. How do we keep track of all those things, both asset management, and then make sure that they're not creating risk to the hospital with security issues? And by assets, we're talking about the PCs, the Internet of Things explosion, as well as maybe you're on a separate device completely, like maybe you're at someone's house and you have to make a reach into the office for some reason. So again, asset management, are you using your assets? Do you have the right amount of licenses as all these Internet of Things pop up? Can't put agents on a lot of these devices. So how do you make sure they're secure, not creating risk to the organization? How do you make sure you don't have rogue devices out there on your infrastructure, as well as people with shadow IT initiatives? And the technical debt. How do you keep migrating to newer technologies that are built in this new model we're going to talk about shortly? On the risk and security side, how do you make sure that they're patched, that there's not vulnerabilities on all these devices? How do you mitigate that vulnerabilities? How do you detect threats? How do you audit and make sure you're in compliance? And then and governance also. So it's really a challenge with an exploding landscape. So let's talk about aged infrastructure versus modern infrastructure. We're talking network and security. In the old world, you kind of had your mobile workforce, whether they were at home or somewhere else. You had all your cloud SaaS apps, your public cloud, and you could run your Epic. For instance, you could run it in your headquarters data center, or you could run it as a service through the internet. What's really blossomed now is that perimeter from being around your internal data center is now everywhere. Whether it's the mobile workforce, whether it's your customers are part of your perimeter, your offices, your hospitals, wherever you might have clinics, they're all part of that perimeter now. So the whole strategy of new infrastructure is to really move that decision point to the edge of the network from a centralized decision point. And there's a lot of benefits to that. And we'll get to that in a minute. So here's some of the requirements: is you need to have, how do you authenticate people? All these things don't have agents or devices. So you need to have either 802.1x, which is what your PCs use, to agentless control while implementing a zero trust model, which means that you have to validate what you're allowing to access what in your network before you allow it to happen. It's no more of that assume and then let someone in. It's you have to validate and then let in. You need to have, if you're going to run in a big hospital and you have Internet of Things devices all over the place, you need to have indoor location services. And they got to support BLE and UWB, all different types of technologies, and hopefully and even batteryless tags. So you don't have to worry about batteries going dead and losing assets that way. And when you have that work from anywhere, whether it's the person or your IoT medical device, you need a resilient network and you need automation. And you also need to be able to handle all these real-time applications like telemedicine. You got to have a network that is resilient so that you can make sure that that application is performing and you don't have a single point of failure, whether it be a link to the internet going down, whether that be something wrong with your device. How do you make sure you understand what those causes are and proactively fix things, like possibly a bad cable in your remote clinic? And then the last thing is you need a source of truth for all users and devices and assets, so you can consolidate and make quick decisions on where people are and what kind of risk they may be at, and apply risk policies based on that. So the modern infrastructure, we talked about having that perimeter now distributed versus centralized. And also you need that single point of truth. What does that really look like? That is a single point of truth for your addressing. And that's things like info blocks with their DDI or DNS, DHCP, and IP address management. Industry leaders, they can integrate with all your security tools via SOAR, if you're familiar with the acronyms, or endpoint intelligence. You can integrate with ticketing systems like ServiceNow. You can provide a source of truth for who is on that IP address, who is using that DNS address at all different times, whether you're at home, on the go. So it really allows you to quickly isolate performance and security issues by having a single source of truth for your DNS, for your network, and making sure that you know on the wired and wireless network where that is, and then on the locations within like a hospital, where do you know where all those devices are? So if you modernize these key points, now you've created an infrastructure that is always there. And the term for this is the vision for the future is a self-driving network. And we talk about infrastructure and security in terms of day zero, in terms of day one and day two, the design and testing. We've helped many clients develop an infrastructure that meets all these requirements. And also some of the benefits are it allows you also to save money on your insurance if you've done right. The more you can prove, the more cost effective your insurance is. And really, this is, again, we talked about the work from anywhere with the zero trust model. Again, a great use case there would be, say you're a healthcare professional and you're out of town on vacation and you have to log in maybe at your parents' house or something like that. And then how do you apply policy if someone wants to go directly to like the Epic system? How do you make sure you put the controls around that particular device, even though it's a bring your own device type of application? And there's intelligence you can build into these zero trust infrastructures, like redirecting someone through your security controls, even though they're on a non-managed device. That's a great use case of what a modern infrastructure can allow you to do and allow people to work from anywhere. But you have all kinds of components to do something like this on the plan. And we've done this for many organizations, Fortune 500 to 1,000 user companies. Just to give a little plug for day zero, that we talked about that wired and wireless network, that indoor location services, where are those IoT devices at this point? And then how do you get that resilient uplink to the network in a very simplistic matter that auto heals? Something of interest I pull up here is that there has been a paradigm shift. Kind of like back in the days when Palo Alto Networks created the application layer firewall and CrowdStrike created the EDR market. Now Juniper Networks has really created this. Now you notice they've been in the magic quadrant for wired and wireless LAN. They're in the magic quadrant for indoor location services, and they're in the visionary quadrant for the WAN access. That's a big paradigm shift in the world, and I'm using them as an example because it is a paradigm shift and gets my point across in this little bit of time I have here. And then you got your security infrastructure. So you have to figure out, put that zero trust infrastructure on top of this. Are you going to use something like the info blocks we talked about to have that single point of truth working with your Active Directory, maybe your Active Single Sign-On, and then your people like your Palo Alto and Zscaler to implement a zero trust infrastructure and security at the edge. And then things like Armis and Forescout to allow you to handle all those IoT devices that don't authenticate with the network natively. So these are some of the things that we consider, and these are some of our focus partners that we help customers design and integrate them to work as a system together, hence the XDR reference there. And then now you need to deploy it. And basically, Synercomm has, for over a decade, provided global logistics services. I provided a link there that has a video describing it. We also have an asset IT portal. We have customers, for instance, that have thousands of Juniper assets. We help optimize those total cost of ownership of the whole system, not only within the particular vendor, but also trying to take out redundant functionality across your ecosystem. And people that we've done this for, a large assisted living company with over 2,000 locations, across the country. We're doing a wired and wireless infrastructure refresh for them using our services. We also have a large financial and healthcare exchange provider where we're doing asset TCO optimization, staging, and global logistics for them to get that network deployed quickly and effectively and not having to take your people away from doing what they need to be doing. They don't want to be warehousing 40 pallets full of wireless access points. And then on the day two side for ongoing management, once it is deployed, again, I will use the paradigm shift that we were talking about here with the AI-driven MIST platform, where ServiceNow deployed this and actually reduced their own trouble tickets by 90%. We have a Gap case study where they reduced the need for technical support staff in remote locations by 85%. An example would be if you have the platform, you can actually detect things like bad fiber cables or bad patch cables, which if anybody's got experience troubleshooting in a network, they can manifest itself in lots of different ways, and you can spend hours and hours trying to isolate something like that. So proactive availability, big cost savings, and some unique technology on the WAN access, where instead of creating tunnels everywhere, they control sessions and can reduce latency on things like Team and Zoom apps by up to 60%, which if anybody's had one of those Zoom apps that doesn't work well, you can appreciate what I'm saying. Again, that's the Juniper platform that we were the partner of the year a couple of years ago. So very familiar and very excited not to be a product pitch here, but we've helped lots of customers and seen the results, and we're pretty excited. And if you want, we also integrate with things like Cisco and all the other pieces. We plays with all the main players, Extreme and Arista. And then the new thing now is the Mist AI agents, for things like Marvis. You can talk to it and say, why was the Teams meeting at the clinic bad yesterday at 2:00 p.m.? You can ask it questions like that, and it'll come back with the data and tell you that, they either had maybe a Teams issue or possibly a link was down or other traffic on the network. So instead of network engineers having to spend hours digging through logs, you can come back and really changes the paradigm shift of how do you manage a network, and allows your teams to spend their time on what's important. Also, we've got a best-in-class information assurance group. We've been for over a decade. We've been providing these services to mid and large enterprises around the world. Some of the things we do in order to have an effective program, you need like global threat intelligence. We provide that through our Chasm app, which is our attack surface management app that's continually discovering assets accessible from the internet. And then we provide that full range of red team services you see there, anywhere from web app assessments, API assessments, multi-factor authentication. Are you susceptible to things like password attacks? People like Active Directory, and most systems can enforce complexity and length, but not words like password 1, 2, 3, 4 exclamation point is still good. So that creates risk across your organization. If you have like 20,000 users and maybe 200 of them have that, if I get one account, I can now have access to 20 accounts via usernames. And then to help tune your systems, we provide purple teaming, where we actually replay our pen test results with your blue team so they can tune their controls. We have some large healthcare providers that use that platform. And we've actually had third-party government agencies bring us in for states to do third-party validation of the MARS-E compliance for market providers. So we work with the biggest of the big. That was the state of California that actually has brought us in recently on some accounts. So we're here to do that. We're a unique company that provides you both infrastructure optimization and security at the same time. And as part of the seminar, we're offering you a 14-day subscription to our application attack surface management. It's always very interesting to see all the different things that may be accessible to the internet that you're not aware of. You can also facilitate that you can only do so much with the machine by having human-led pen testers look at those results and look for other recommendations. We talked about all the password issues a large enterprise has, and we do this regularly for the largest of the large too, is analyzing across your whole Active Directory infrastructure, for instance, for password reuse, easily guessable passwords, and things that can lead to exploits. And a couple of reference materials for people on how to align your controls that we base our stuff on is a data-driven defense book by Roger Grimes, as well as The Future is Faster Than You Think. It really talks about all this escalating technology like we're seeing with the low code and discussions we're having. Thank you for your time. Ron, back to you.
Through a lot of details there. The important thing is that your healthcare technology platform has exploded in complexity with telehealth, with EMR, with the public cloud, with this Internet of Things where doctors don't even go in to check your blood pressure. It's all Bluetooth sensors communicating over Zigbee, going over Wi-Fi. that creates so many different opportunities for productivity. And at the same time, it does create new vulnerabilities. That's where you need some of the solutions and capabilities offered by Synercomm, and encourage everyone to make the appropriate follow-ups and take advantage of Kurt and his team's expertise. As I said, he's based right there in Wisconsin, the capital of EMR in the world. So there's a little bit of not only love for the Bucks and the Brewers, but also a great local affinity and expertise in healthcare specific applications.